I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It's December 17th, and we're doing our weekly update here. I'm joined by Julianne and Dr. C. Do you all want to say hello?
Good morning, Julianne here.
Good morning, Dr. C.
All right, so today the big topic on everyone's mind is vaccines. So let's talk about that and what we're expecting for Wyandotte County and vaccine rollout. Julianne, do you want to talk a little bit about what the health department is doing and what we're expecting in the next week or two?
Absolutely. We are excited to be able to say that we expect to receive about 800 vaccines out here at our Kmart site at 78th and State next week. We don't know if it will be December 22nd or 23rd, but it sounds like midweek we will be able to receive those. We are ready for them. We've got our fridges and our freezers hooked up. Our staff is working furiously to get their workflow all ironed out. The folks that we'll be vaccinating very first will be our own workforce. So all those folks who have been testing our population diligently over the last many, many months will be at the front of the line, as well as the staff here who will become vaccinators themselves. We'll have that available to them first. So very excited to be able to provide that to our public health workforce who have been doing such a tremendous job for us. Immediately behind them, we'll also be vaccinating our EMS across the county, our public and private EMS, those folks who do those ambulance services and do those runs when people are in an emergency, really need to protect those folks as well. So we'll take those two chunks off the next couple of weeks here with our first allocation of vaccines, and then we'll move forward with vaccinating the broader healthcare associated workforce in Wyandotte County.
So what do you mean by healthcare associated workforce?
A great question, thank you. And we say healthcare associated because oftentimes a lot of the folks who are in the clinics or in our primary care offices are not just doctors and nurses. They're custodial staff, they're in-person interpreters, they're other paraprofessionals. It's the person at the front desk who takes your insurance card and your information. They also have close contact with people who are ill on a very regular basis. So we want to make very clear that we're not just talking about those people we often traditionally think of in the healthcare workforce, but everybody who is in those settings and who are putting themselves at risk on a daily basis.
Yeah, and thanks for explaining that, because I think that can be confusing sometimes, but that, makes a lot of sense. And I know we've also heard things about later phases where there will be other essential workers or people with certain pre-existing conditions, people over age 65, but those are some pretty broad criteria. What things will impact how we get more details on those criteria and what that's going to look like?
I'm very glad you asked that. It's a question we're getting a lot already. Unfortunately, we don't have great detail to share immediately, and that is because a lot of these decisions are happening at the state level. So we do know that phase 1B or the phase after the healthcare associated workforce does include, as Janelle mentioned, our essential workers, our 65 and older population, and those folks with pre-existing conditions who are at risk. But within those categories, that's a large majority, unfortunately, of our community, which makes it hard to know how do you prioritize within those groups. And so we believe KDHE will be coming forward with tighter guidance on that in coming weeks. And we, of course, will follow what they set out for us.
Yeah, what guidance they have, and depending on the vaccine supply available, that could affect it as well.
Absolutely.
Janelle, I also want to make the point too, though, that within Wyandotte County, we are expecting some tighter, guidance from KDHE, which will be great. But within Wyandotte County, we've got a group together, and we're putting that ideal of equity and fairness first in our minds. We're working with an ethicist on this issue as well, just in case we actually need to put those details into place for our own county. And so we're hard at work, on that as well.
Thank you, Dr. C. That's a really great point. And I actually wanted to talk to you next too, because we know that hospitals in our area have already received vaccines to start vaccinating their own staff. And I know that you are at KU. So do you want to talk a little bit about what that means for you and for other folks in the area?
Sure, thanks. Yeah, so it's great news, everybody. You know, we've got vaccinations over at the KU hospital for those workers who are coming into contact with COVID positive patients quite a bit. So many of the people within the ICUs, the folks who are working in our emergency department, you know, really they've been working tirelessly. So there's a lot of joy, kind of joyful feelings over here. Of course, we've also had the vaccine delivered over at Providence as well. So both of our hospitals in Wyandotte County have received shipments of the Pfizer vaccine. That is the only one at this point in time that has emergency use authorization through the FDA. The good news is today the FDA is going to make a decision on the Moderna vaccine. They're going to take a vote on it, and then we'll know within the next couple days if they also issue an emergency use authorization for that Moderna vaccine. So I want to share some good news about myself. I'm pretty happy. So I work in the emergency room sometimes and see patients there. And so today I received my vaccine. And I have to say, I feel great. And it didn't hurt at all. It actually was a lot easier than even the flu shot. So I just want to encourage everybody to get the vaccine. It's really, really important. And we'll be the guinea pigs and such. But I have to tell you all, I feel great.
Yay. That's incredible. It feels like, I keep saying, the light at the end of the tunnel, and there's a lot of tunnels still to get through. So really important that we keep up that mask wearing and social distancing, because vaccines do not mean that today we're free from COVID. But I think that that light and that ray of hope is just something we need so desperately right now. And it feels great, honestly, among our staff to see them feel hopeful.
Julianne, that's a great point. You know, this is not a get out of jail free card, you know, the get the vaccine kind of thing. I've still got my mask right here sitting on my desk, and I wear it every time that I leave my office, and I'm going to continue wearing a mask. It's extremely important. One thing that we are not sure of yet, because, you know, the vaccine is so new, I may be in a few weeks protected or have some protection with my immune system to the virus. So maybe I won't get very sick if I get exposed, which I'm grateful for. But what we don't know is if I were to catch a mild case of the virus, if I might still be able to pass it on to others. So I'm going to be really diligent about continuing to wear my mask. There's really no end in sight on how we wear our masks and socially distance. And so I'm going to keep those principles, you know, close at hand and thinking about the holidays and keeping my family safe, my friends safe as we go forward.
Right. And even for you, after you've been vaccinated, it takes some time. So after your first dose, what is it, for the first 14 days or so, there's not any immunity yet. And then you're really, the full effect is a few weeks after that second dose, is my understanding. Is that accurate?
That's correct, Janelle. We think that the most important time is, you know, those first couple of weeks. And then after, you know, that second dose, only a week or two after that can we really say, yeah, you probably are getting that 95% protection from getting really sick from COVID. Mm-hmm.
Yeah. All right. Well, you mentioned the holidays, and I want to wrap us up by talking about the holidays for just a second. We know that this time of year, a lot of people are planning to have gatherings or see their loved ones in some way. And we just want to remind people of how important it is that if you are choosing to get together, that you take those precautions to keep it small, that you're still using masks and distancing, and you consider getting tested a few days beforehand, you know, giving yourself those few days to make sure you get your results in time. Because it's just so incredibly important. We know that after Thanksgiving, we have seen some outbreaks tied to Thanksgiving related gatherings. And so we want to prevent that from happening after Christmas and other holidays as well. So we want to let people know that we still have testing available at 78th and State, though we do have some reduced hours for the holidays. So on December 24th, on Christmas Eve, we have shorter hours from 8 a.m. to 11 a.m. and we are closed on the 25th for Christmas Day. We will be open on New Year's Eve on the 31st, but then we will be closed on New Year's Day on January 1st. So, but otherwise we'll be doing our regular Monday to Friday, 9 a.m. to 3 p.m. hours. You can find more information on testing and other COVID-19 information at wykokck.org/COVID-19. Thank you so much. We will talk to you all again. We're probably going to take the next couple of weeks off to give folks some breaks around the holidays, but you'll hear more of these weekly updates from us after that.
Thank you. Have a great holiday, everyone.
Happy holidays, everybody.